Hello, this is Jerry Thompson again with another show for you on Welcome to the Talk Table. And today is a special edition because it happens to be PA Week, which is Physician's Assistants Week. And if you don't know what that is, this is the show to watch. We're going to tell you all about what it means to be a PA and how they help us and how they are instrumental in the front lines, especially now during this pandemic. They play a very vital role, and we have two PAs right now that are going to just share what they do and why they do it. So I'm going to bring on Anna right here. This is Nana, and he is a PA in urgent care, and he's going to really explain about himself, why he loves what he's doing, and actually what he does.
Thank you.
Go.
All right. So my name is Nana Kyoko. I'm a physician assistant, mostly in the urgent care. And as I told Jerry earlier, when I started with an emergency room. So at this moment, I do both emergency and urgent care, but mostly full time in the urgent care. So something a little bit about myself. I'm currently married with two kids, a boy and a girl, a 6-year-old, and then a 2-year-old. My wife is also a nurse, but I'm originally from Ghana. My dad is a Ghanaian. My mom is a Liberian. I was born in Liberia and then moved to Ghana. So I lived with my family members in Ghana until I moved to the United States in 2005. When I had to do my college degree with a community college in Albany, and eventually went to UB Buffalo, and then graduated from DUville, which is a private school in Buffalo. I graduated in 2015, so I've been practicing pretty much for about almost 4 to 5 years now since I graduated.
Nice.
Earlier, I just went into emergency right after that, and I think I gained most of my experience and skills from emergency before moving to North Carolina, which is currently where I am right now in Raleigh, North Carolina,
Mm-hmm.
and with one of the biggest urgent care here in North Carolina, FastMed. So I've been here for about 3 years working with them.
That is awesome. Wow, that's a lot of time. So urgent care. Tell me a little bit about that.
All right. So pretty much, if you think about the urgent care, I would say it is between the emergency and your primary care, you might say, because we still see, people with high blood pressure who comes in, and then if someone comes in who don't want to go to the emergency room, they want to come to the urgent care first. We still see them. And if there is anything that is concerning that we think that we cannot manage here, we'll send you back to the emergency room. And then if it's something that is primary care, we advise you that to kind of follow up because it's a long-term kind of like, care that the patient may require. And so anything like, as the name goes, urgent care, something that is urgent. So
Mm-hmm.
we see infections, cough, pneumonia, any those kind of urgent stuff that you don't have to spend your time in the emergency room waiting. We do see them here.
Well, it's interesting that you brought up primary care because we actually have a primary care PA on the show. So I think now would be a good time to bring her on, so then we can see the contrast between urgent care and primary care. So we're going to ask her to come on the show right now. Hello,
Hi.
everyone. This is Sham, and she's a PA in the primary care specialty. And just tell us a little bit about yourself, and then tell us about the primary care.
Okay, so I have been a PA for past 6 years. I graduated in 2014. I also am married and have two kids. One is 2.5 years old, and the other one is 11 months old. I have been working in primary care in the same clinic for the past 5 years. I live here on Long Island. I cover 2 or 3 clinics in Queens area. Um, so yeah, that's about it.
Okay, nice. So primary care. We heard what urgent care is. What is primary care?
Well, where I work, it's mostly like walk-in clinic. So it was like working as urgent care and primary care, but we do have set scheduled and set patients who are coming in. And not only they're coming in for acute issues, but we are managing their chronic problems such as diabetes, hypertension, um, anything like that. And then it's family medicine that I work in, so I'm seeing anyone from 1 week old to 100 years old, males, females, everyone. Of course, we see some of the urgent care too, and if we cannot manage it, send it to you because we don't have the supplies or anything like that, or it's something that needs to be sent to ER, then we send them to ER. But usually, if it's something small, like now this season, cold sniffles and whatnot, that's what we're managing, and then we're managing diabetes and hypertension and like stomach pain and immunization, physicals, things like that.
For those who don't know, we're going to ask you. Any one of you can answer exactly what is a PA, but it was established in 1967. So you guys have been around for a while. And the United States, there are over 125,000 PAs. So you guys play a really vital role in administering health to the nation. And we thank you for that. Anybody wants to explain exactly what a PA is between, they got doctors and nurses and exactly what the PA is.
You want to go ahead?
Go ahead.
Okay. Well, it's difficult, I think, to compare. I really usually don't like to compare, even when it comes to compare between PA versus nurse practitioner, because everyone has their own role. So I work in a clinic, and I do have 2 physicians and 2 other PAs who work alongside with me, also a nurse practitioner. When we're seeing our patients, we're all taking care of the patients exactly the same way.
Mhm.
There's a knowledge and the experience from my supervising physician. So if there is something that I'm lacking the knowledge of or the experience of, or something I'm seeing it for the first time, we will have the supervising physician to kind of help us out, get a little more help. But I think that just speaks experience. Otherwise, it's really difficult to compare for nurses. It's different for nurses because the way that they're taken care of. But between nurse practitioner, PA, and a physician, yes, the degree is different, the amount of knowledge is different, of course. I give the respect to physicians for their knowledge and for the all the years they went to school for med school and all of that. But then I have some great PAs with a lot of experience, and we're treating the patient the same way. But then between one physician to another, everyone has a different way of going about for the same issue, for the same complaint. So I think that's what I would really have to say. It's kind of difficult to compare. I really
Right.
don't like comparing.
Okay. Would you like to add anything now?
I mean, she pretty much explained a whole lot about it, and again, it's very hard to kind of compare, because when you, like for my case here, as I said, I work in emergency room too as well. So when I'm seeing patients there, I'm seeing patients as a doctor will go see a patient, like stroke patient, like heart attack patient. The only thing is like um, sometimes you have to report some stuff to the medical director or the person who's the attendant who's available if you have any question, which is good because I didn't go to medical school,
Exactly.
but most of the stuff in most of it is just like from like master degree kind of
Mhm.
type of stuff. And the good thing is you develop a good relationship with them, And that goes on, they begin to have trust in you that you can manage a patient, who comes because you've seen it before, you've done it several times.
Right.
And that's one thing I like about it too as well.
Yeah, a lot of times when I go to the doctor, I'm seen by a PA, and I get the same care, and I when I leave there, I am satisfied that the care I got was professional. So I really encourage young people. In fact, I should mention I am also a teacher in
Mhm.
high school and stuff like that. And they would ask me from time to time, you know, what shall I do when I grow up and different things. And I actually tell them an option is being a PA because
It's a
it's
great option.
it's a good option and it's you are helping people. It's also lucrative. That's important, and it's a noble profession. Um, we're going through a horrible time right now with the pandemic. Any experiences on what you went through during the pandemic that you would like to share? Anything that stands out? We can go with Shan.
Okay. Um, well, since I am in primary care and we were walk-ins, we saw more patient symptoms when we were not prepared.
Right.
That was definitely one of the hardest thing coming home and then just getting nervous the entire time because I have a 6 months old and I have a year old. I mean, 18 months old at the time. Um, and since it was walking, we don't really have the measurements and all of that. It wasn't easy, not only on the patient, of course, because they were nervous. And then they were our patients. We were seeing them and we needed to be there for them. Um, but at the same time, it wasn't something that we went through ever before. So we were also nervous for our family and bringing something home. So that was definitely not a good experience until we stopped seeing the patients in person and started doing the televisit. But then again, even when doing that, the patients were sick and were calling us, and we know they're most likely are COVID positive and they're home. And there's nothing really that we can do other than we're telling them if the symptoms are getting worse, they're going to the emergency room, and then we're there for them. But it was just too much emotionally, like support that we needed to give them. I had one patient that I think I must have spoken to him 3 or 4 times a week for 3 or 4 weeks straight, just to kind of tell him, okay, now you're feeling better. Okay, then stop thinking now what something happens. I have no idea if something will happen tomorrow or if it won't happen. So I can give you a little bit of faith that whatever we could do, we did it. And we're doing it and we're there for you. But at the same time, you need to know the limits and we need to know our limits. Um, I think it was like the worst time. I don't even feel like thinking about it all
Wow.
the time that passed. And I'm in Long Island, but the clinic that I worked at, it was Floral Park, and it was on Hillside Avenue that got hit pretty bad, right, not too far away from LIG.
Wow.
So we saw more and more numbers than anybody else saw. So that fear was definitely there. I'll let you start.
Okay. Uh, would you like to add anything now?
Earlier, Mr. said something about advise you students to professional PA. The thing about it is the fact that you can actually switch between different specialties. So if you're in primary care, you don't like it, you can move to theology, like emergency or urgent care. So it's like very flexible. That's something I wanted to throw in. However, the COVID, in the urgent care here. So when this whole COVID thing began, our clinic here, which is one of the part of the FastMed clinics here in North Carolina, was one of the clinic that started with the COVID testing, because we lost a number of people, which mostly had to do with like patient coming in because no one was coming and everyone was afraid to come. But when we started doing the COVID test, our first patient actually thought that she had COVID, and thankfully, she didn't end up having COVID. However, as time went on, we started seeing a lot of people, and literally a lot of patients with COVID came in. I've had some of them coming in, short of breath, and I literally had to do a chest X-ray and then finding out they have pneumonia, and some of them have to kind of tell them to go to the hospital because how bad it is. Their vital signs kind of matching out as they're supposed to be, and some of them, mild symptoms, which we continue to see them. And as I'm speaking, I'm still at the clinic, but we continue to see these people still doing the testing. And myself, from that, I got COVID from here too.
Oh wow.
Yes. So, and I was like somewhere in July, I got it from here. But by the grace of God, I was able to kind of like fight it off. So like I mean, you begin to understand how patients are going through when you yourself get sick. Then you begin to treat them well because it's not easy. So it was a good experience seeing all these people coming in, and I've always put my patient first and making sure like you're doing okay. Now if there is cases of patient with like chronic disease and anything like that, even though they have mild symptoms, sometimes I may go further like antibiotic, but they don't have secondary bacterial infection from just like having the COVID. So and again, I've seen a lot of patients with COVID in the urgent care, and most of them, yes, have done well. As far as I know, done well. And some of them, you don't follow them, so you don't get to see what happened to them. Sometimes I'll give them a call and say, hey, how are you doing? How did things go when you went to the hospital? And some of them are still coming back, retesting, and then, they were patients that I saw or so they're doing well.
Wow, that's incredible. I mean, they on TV they always talk about the COVID-19 heroes, and you guys are definitely heroes. I can't imagine being in a job where you're exposed, like literally. That's your job, to be exposed to the virus, and that's very commendable. You mentioned now. I couldn't hear everything you're saying. So you mentioned that as a PA, you are trained in a wide area of and you can go from different like situations. Just expand on that a little bit. Well,
Yes.
in terms of in case there are young people out there who would like to go into this profession, know that different kinds and they can branch off into different ones.
When we're trained.
Thank you.
Your volume is off.
Can you hear me?
Yes, can you hear you?
No, so in the PA school, when we're in school, we are trained in different specialty, and when you come out, you come out as what you want to do. And as I said, when I started, I wanted to do like emergency, and then eventually I branch out from emergency to do like urgent care, and then you see like Sham, mostly the program is structured in such a way that it goes towards primary care. However, the good about it is eventually you can specialize in anything that you want to do. Now, when you're doing maybe orthopedics, and then you do not like to be in orthopedics or you're tired of it, you can always switch to do something different. Like, you can go into dermatology, you can go back to primary care, you can do urgent care. So you don't need to go back to school for that. You can just kind of like, all you need that is just getting to know your stuff and someone hiring you for it. So that's one of the great thing about it. It's flexible. You can places to place.
And you can also do that at the same time too. It's not that you do one thing and then once you're tired of it, then you stop. So I could do primary care part-time or full-time and then still have per diem, urgent care, or emergency room or dermatology that was ever available. Definitely.
Oh wow. We're going to take a short break, and when we get back, we actually have a dermatology PA who's going to talk with us as well to tell her what she does, and she's at work right now, so we'll see how we can make that match. So we'll be back in a few minutes.
Super Greens is a one-of-a-kind blend that's loaded with hard-to-find nutrient-dense superfoods. We've used what we've learned from our more than 20 years working with mineral-based nutrition to create one of the healthiest, plant-based nutritional products available. Each superfood was carefully selected so that it complements and enhances the others, helping to maximize Super Greens' nutritional power. Next, we added a specialized fermentation technique to increase the bioavailability of each superfood. Finally, we put in powerful probiotics and enzymes for added digestive support to give you jam-packed nutritional support. Youngevity Super Greens, the highly alkalinizing super supplement that helps balance your body. It's the superfood-powered way to get more organic fruits and veggies in your day, all in just one scoop. Check with your Youngevity distributor to learn more.
And we're back. Again, for our viewers, this is PA Week, Physician Assistants Week, and we are highlighting PAs and what they do. So we were talking with two PAs, and now we have a third. Kendra Joseph, tell us about yourself and why
Hey
you
guys. I'm so sorry that I'm late, but I'm happy that you guys could have started for this evening. So happy PA week to my fellow PAs. So I am a dermatology PA. Thank you. So I am actually currently at work right now. Literally, I have one more patient to see who is here right now, so I actually have to step away from the phone. I'm actually going to ask her if it's okay for us to actually see her.
Okay.
And I'm just doing a really quick treatment for her eczema. So I just want to step away really quickly and then see if she's okay with being like on camera. If not, then I'll just come right back. But what was the question? What did you ask me?
We didn't hear the last part you said.
Oh, I said, what was the question? I think I probably might have missed the question.
You probably said it. Like, tell us about yourself and
Okay.
how you know, as a derm PA, like what is it, and why do you enjoy it?
Okay, so dermatology PA, I mean, practice dermatology. So dermatology is the study of hair, skin, and nails, the diseases that affect those parts of the body. So we pretty much follow the same things that dermatologists do. So we see patients, we diagnose them, we set up a treatment plan, and we also connect them to other parts of the healthcare team. So that's pretty much just a little bit about what I do. We're very procedural oriented, and we do little procedures in the office to help out with different conditions. We also do fun things that I love, like chemical peels, lasers, and things like that.
Okay. It looks like
Yeah.
you have to go, is it? Okay. Well, that's interesting. Again, because
Yes.
before you came on, we were talking about the various fields that you can go into as a PA. So you're a great
Yes.
example of that.
Yes. Yes. So I am actually just going to step away just for 1
Okay.
second. I'm going to ask the patient if she's okay with being on camera, and
Sure.
then I'll try to see if I can work it out. If that's okay.
Sure.
It'll take me literally 2 seconds.
Sure.
Okay.
Okay, no problem.
What did you say, Shan?
I said go. We've been waiting.
All right. Hold on.
All right, so it looks like it's just you and me. What would you like to, in terms of how we take care of our bodies, what advice would you like to give? Because you see a lot of different types of ailments and different problems with people's health. What would you like to say that how we should take care of our bodies?
How? I would say we usually know more about our body than anyone else would. When a doctor, when you go to them. So first of all, be honest to yourself. You know if you're healthy, if your habits are healthy. So if you're not taking care of yourself, your body would show. You won't be achieving anything that you want to the point if you're not taking care of yourself. So I usually see young adults too who are like in a denial, especially when it comes to obesity or eating habits or anything like that. And I always tell them that the numbers are right there, and I don't even have to give the numbers. You can look at yourself and there are a lot of other factors. So, but if you know that it's something in your hands, but you need an extra nudge and extra help, until you get up and ask for it, it's not going to work. So there's always people offering help, but it doesn't really work until you are ready to step up and start taking care of yourself. And that could just be eating healthy, taking the time out for your mental health. Even if, however busy you are, you're doing 2 jobs, 3 jobs, doesn't matter. Even if you have like 5 minutes where you can do something that makes you happy, do that. If you're mentally happy and your body will show that, you would be healthy. Of course, if you have done everything and you're unable to achieve your goal, that's where the providers come along. So be honest again, tell them how far you have done, what have you done, and what sort of help you would need. If it's something that just a reminder, if it's something that you just don't have the confidence, then you sort of kind of need a cheerleader. Most of the time, I feel like I do that for people. So until you open up, until you ask for it, you might not get that. But start taking care of yourself and it would start showing.
Okay. Awesome. I think we have Kendra on the line who's about to tell us something about her patient. Let's see.
All right, so I'm back. So I
This
spoke
would
with
be
my
a first.
Can you guys hear me?
Yeah.
Yeah.
Just a little louder, but sure.
Sorry, it's really loud in here because the laser machine is
Okay.
on. So I spoke with my patient and she's okay with us filming her or seeing her. So she has a condition, it's eczema, where your skin is very inflamed. And sometimes with darker skin patients, you can also have like light spots. So we do like this treatment of using UVB or sunlight technology to kind of help decrease the inflammation in her skin as well as repigment the skin. So I'm just going to do it. It literally takes a few seconds and it doesn't hurt.
Okay.
Just bear with me as I flip the camera. Just give me 1 second.
Okay. This. Okay. All right. So we are looking at a patient being taken care of by a dermatology PA live on the talk table. This is the first. So unfortunately, with the mask, I was not able to hear exactly what's wrong with the patient. But
Eczema was
eczema. Okay. Eczema. All right. And she's getting
that before.
and she's getting laser treatment. Okay.
Primary care here.
Yeah, this is interesting. Okay. Looks like a laser.
So you can see like she has regular hair and her skin also is a little depigmented, like lighter. So we just pretty much put the hand piece directly on the skin.
Okay. That doesn't sound scary at all.
It's not scary at all. It's very straightforward.
I'm just kidding.
So that's pretty much it. And so I'm gonna continue her treatment while you guys talk.
All right, you go right ahead. We are intrigued. Oh, where'd you go?
That's it?
Oh, you can relax that.
Is that it? Is that the whole treatment?
It's not the whole treatment, but I know due to the interest of like time, I'm gonna let you guys continue, and then I'll actually be right back.
Okay.
Okay.
All right. Wow. Okay, so that was interesting.
It was.
Being being zapped on live TV. Okay. What sort of, I don't know, exciting things like that do you experience? What sort of like technology do you use in your practice?
Not that much of technology at all.
Oh,
It's just stethoscope usually does the trick.
okay, okay,
So
okay.
it's like either we're hearing pneumonia or I have had actually a couple skin cancer patients also that they came uh, they came to me and then I had sent them to dermatology because it looked like cancer and it turned out to be skin
Wow.
cancer also, but there wasn't any test that I had done. I just sent them in other than like the blood work and all of that. I had sent them in the usually EKG. That's like one big thing, and then I end up with my experience so far, and I have been catching a lot of bad stuff on EKG. So
Yeah.
to the point that recently we had a patient sent into ICU with the heart rate of like low 30s, and she ended up getting a pacemaker the next day. And she came to primary care, so with no complaints.
Wow.
Not a big technology stuff other than just the EKG stethoscope.
That's
My eyes.
technology. That's still technology. In fact, not sure if I should go there, but even your iPhone is now trying to.
Yeah, pulse and all of that, right? Yeah, I
Yeah,
know.
you
I have
can almost
patients who
have.
tell me that.
Oh, wait, I think she's back.
Okay, sorry about that. I'm back now. All right.
That's okay.
So where are you guys? What are you guys talking about?
Well, like my kids are losing patience because
Oh, okay.
their bedtime at 7:30, and I'm making them wait.
All right. Well, it's okay.
Oh
We're
no.
glad to have you.
No,
If you do, you need to go now.
I think so. They're keeping
Yeah.
me.
Well, we were talking.
Bye.
We were talking with
Oh.
Sham. She's a primary care PA, and we were just glad to have her to share her experiences with her.
Well,
Nice to
thank
have
you
you.
for this. I enjoyed it. I'm glad that I was able to come and join you guys. And happy PA week to everyone.
Thanks. Thanks.
Bye. Thank you.
Yay.
Yay.
Bye.
Bye. So, first things first, is the patient still alive?
Yeah,
I,
had a rough
I thought
day, but
I saw lasers and things making strange noises, so I have to ask.
no, it's all good. It's actually kind of fun actually, but yeah.
So I wanted to ask Sham this, but she had to go. So we were talking about technology and what kind of technology you're using. What about telemedicine? Have you been using that?
Yeah, so actually, for me, before COVID, I was not using telemedicine, and I was actually really happy about not using telemedicine, mainly because in dermatology, not only is it a visual exam, because people always say, oh, all you do is just look at rashes all day, but we also feel the skin, right? And we also feel the area. So palpation is what we call it, is also part of the exam. And with telemedicine, you don't really have that ability. So for the longest while, when it was introduced to me, I was actually very hesitant during the first portions of COVID. But it actually came in handy. I was able to actually see and take care of a lot of my patients even while we were not in the office. So, even my office now that I work at, they are still incorporating telemedicine. So it actually has been helpful to have that tool and that technology for medicine because of the whole pandemic.
Yeah, for those who don't know, telemedicine is the way you can see a doctor now just by using your phone. Your doctor's on the phone by video conference. and can help diagnose or prescribe or whatever we all do. And you guys have been using it a lot for obvious reasons.
Yeah.
Um,
And then
so
also in terms of like quality of life, like personal, sometimes it was actually kind of helpful to be at home, because when you're in the office, sometimes just regular things that we should be keeping on top of, like drinking water, we don't really get a chance to do because we're like always, rushing and hustling. But when I was home, I was able to do more self-care things. So it actually was a little bit of a break, but it was a little bit of a good break while I was still able to help my patients.
yeah, even before you came on, we were talking about the danger that you guys find yourselves in because of the virus, and even PA Nano, he actually got the virus, right? And
I didn't
I
know
mean,
that.
thank God he's alive, so he went through it. So you literally put your lives on the line for us, and again, we thank you for that. Um, I was talking about health, and is there anything you think we can do with our skin, to protect our skin? Since you are in dermatology, things we should not do to our skin.
There are like so many different things.
I know.
I know you're only asking for one. I think the one most basic thing that I think everyone should actually do is actually moisturize. So I know it's not very fancy. I didn't say anything like, all the different fancy treatments that you could do out there. But the skin is the largest organ, from the entire body. It protects us from the outside world. So whenever there are any cracks or any breaks in the skin, then we're prone to getting different kinds of skin infections, right? And skin disease. So if everyone actually just moisturizes on a daily basis, I think that'll help tremendously with the health of your skin. So it's very basic, but I still think it's very important, because you'll be surprised at how people do not apply moisturizer. Like, it's just not a part of their routine.
But okay, but what is so bad about dry skin besides the fact that it makes you look like a reptile? But what's so bad about dry skin?
It looks a hot mess. It looks bad. No one wants to be ashy, right? But it's just not good. The integrity of your skin, it's a barrier, right? There are different components that make up your skin. And if we don't protect that barrier, then different organisms like, bacteria can get inside. And even for other kinds of autoimmune conditions, you increase your chances of, getting those kinds of conditions. So overall, it's just better to just protect your skin.
Okay, it's the largest organ in our body, right?
Hmm.
And in fact, there are some medications that we take through our skin, right?
Yeah.
So, in my mind, if we can get medications through our skin, and you can talk to us about that, that means there are bad things that can also go into our bodies through our skin.
Absolutely. That is correct.
Okay. All right. So, all right. Got a thought. All right. So, you're doing an awesome job over there. I was hoping to have Nana back, but I think he's seeing a patient, so we're not going to have him back. But yeah, it was great to have you guys. This is a first. We were able to witness
Thank you for having us.
live zapping on the show. That never happened before. And patient is alive. All is good. Yeah. So
Yep. That's all we try to do, right? Keep them alive. No, I'm just kidding.
So it's PA week, and we want everyone, next time you see a PA, just thank them for all they do. Thank them for their service, because they're out there, right, literally in the middle of harm's way. Um, I don't know what else PA week has in store. It's from the 6th to the 12th. Um, yeah, it was glad
Thank
to
you.
highlight what y'all do, and just before you go, I asked one of the other guys, what would you advise a young person who wants to be a PA? What would you advise them to do, like in school or anything?
I would say one to really research what the profession is, talk to someone who is a PA, ask them what their day-to-day life is, not only what they do like at work, but also how is their quality of life, right? When we talk about quality of life, we don't talk about like, if you're able to take vacations all day and stuff, that's a part of it too. But also like, what do their finances look like? When you look at other professions, sometimes they may not really be in the best interest of your finances and the quality of your life when it comes to like your family. You want to be able to have, for the lack of a better term, you want to live your best life, right? You want to be able to serve and provide a service for people in your community, but you also want to make sure that you're enjoying your time here while you're on the earth. And so I think as a PA, as probably was mentioned, it's very flexible in terms of what you can do, but it also provides you with a lifestyle that is enjoyable. And I think that's important.
Yeah, if you can be in a profession where you are helping people, enjoying what you're doing, and have a good life, that's more than what you can ask for. All right?
Yeah.
So, it was great having you on.
Thank you for having us.
No problem. We'll do this again sometime.
Thank you for highlighting us.
Just wanted to let the world know that you guys are there for us. All right. That's our show for today.
Bye, guys. Thank you.
Bye-bye. So that's our show. And if you would like any information on that or from our sponsors, let us know. If you have something you would like to share on the show, so maybe whatever job you do or whatever you're good at and you'd like to share your information, check out our page, thetalktable.com, and let me know so I can have you on the show. We'd love to have you to share with others. We just take a word from our sponsors, and after that, see you next time. Thanks for viewing. Have a good evening.
Your body's immune system is under constant pressure from things like stress, lack of exercise, and toxins in the environment. It's crucial to be proactive and support your immune system with the nutrients it needs to function effectively. But it's often hard to get these nutrients from food alone. Introducing fast-acting Zinc Plus Immune Support by Youngevity. Unlike zinc-only supplements, Zinc Plus Immune Support builds on the proven power of zinc and adds complementary nutrients to give your immune system extra support. Vitamin D helps balance the effects of zinc, while our proprietary blend of natural fruit and root extracts provides the extra help your immune system needs to work against daily stressors. And we've included Youngevity's exclusive plant-derived minerals to give your body the minerals it needs but can't get from food alone. And because Zinc Plus Immune Support is delivered in a great-tasting sugar-free berry-flavored lozenge, it encourages quicker absorption of all these nutrients into your body. Zinc Plus Immune Support. Zinc plus the extra support your body needs to promote a healthy immune system. To learn more, contact your Youngevity associate.
Super Greens is a one-of-a-kind blend that's loaded with hard-to-find nutrient-dense superfoods. We've used what we've learned from our more than 20 years working with mineral-based nutrition to create one of the healthiest plant-based nutritional products available. Each superfood was carefully selected so that it complements and enhances the others, helping to maximize Super Green's nutritional power. Next, we added a specialized fermentation technique to increase the bioavailability of each superfood. Finally, we put in powerful probiotics and enzymes for added digestive support to give you jam-packed nutritional support. Youngevity Super Greens, the highly alkalinizing super supplement that helps balance your body. It's the superfood-powered way to get more organic fruits and veggies in your day, all in just one scoop. Check with your Youngevity distributor to learn more.